Welcome everyone to ISCRR's Learning Series today and our webinar on vicarious trauma. I'd like to welcome everyone here today, and firstly I'd like to acknowledge the people of the Kulin Nations on whose land many of us are based today, and I pay my respects to their elders past, present and emerging, and we extend that respect to First Nations people here today. ISCRR is a unique partnership between Monash University and WorkSafe Victoria. It was started in 2009. So we've been working with a range of stakeholders for 13 years now, which has been great. We have our own research team in-house, and we do a range of predominantly rapid pieces of work, of evidence reviews, evaluations, environmental scans, global scans, program logic workshops. So we do a range of different things, but ISCRR also facilitates and brokers research for WorkSafe with other academic groups within Monash University and also around the country. We also have a translation team which focuses on dissemination and uptake of the research findings to optimise the impact and increase knowledge. And today's webinar is part of one of these activities. So for those who are new to the ISCRR Learning Series, each month we present on a topic of our research findings or the impact from our research or best practice management of research. And you can find out about future events by joining our mailing list, and you can do that through the evaluation survey that will appear after this session. Today's session will be recorded and available to view on ISCRR's channels in the future. Feel free to ask any questions you have in the Q&A, and also after the talks there'll be a Q&A session as well. So on to today's learning series session, which is focused on the important topic of vicarious trauma. And it's going to be presented by Carmen Schroder from ISCRR with a special guest, Grace Norrie from the CPSU. So Carmen and Grace work collaboratively on the Vicarious Trauma Prevention and Awareness Toolkit, which is a partnership between the Community and Public Sector Union, WorkSafe Victoria's WorkWell program, the Department of Justice and Community Safety, and the Department of Families, Fairness and Housing. And this major project has been running since 2019 and will conclude this September. So Carmen is a research officer at ISCRR. She leads ISCRR's monitoring and evaluation of the Vicarious Trauma Toolkit project. Carmen has over 10 years of experience working with government, academic, not-for-profit and community organisations to evaluate and strengthen services, systems and policies. Motivated by social justice, Carmen has a keen interest in systems improvement and capacity building solutions. She has a Bachelor of Applied Science in Psychology with honours from RMIT. And Grace is the lead project officer for the Toolkit project at CPSU. Grace holds a Master of Social Work from RMIT University and a Bachelor of Arts with honours from the University of Queensland. And prior to joining this project, she worked for several years in research teams at the University of Queensland and Central Queensland University. So I'm going to hand over to Carmen now. Thank you.
All right. So thanks so much, Janine, for that lovely introduction. And thanks again to Grace for presenting with me today. And thanks to everyone for joining in. Grace and I, as Janine said, have been working on this project for a few years and have really been looking at how to prevent vicarious trauma. So it's really great to be able to share some of these learnings with everyone today. So today we're going to talk a bit about vicarious trauma perceptions and preventions. Hopefully by the end of this session, you'll understand a bit more about what vicarious trauma is, maybe some of the symptoms, the perceptions around it, key features, some things like that. We'll also put to you a case for proactive prevention, so kind of shift from what the norm is at the moment. And then Grace will offer you some examples of proactive prevention applied in the workplace. Now, before I begin, I think it's really important whenever we're discussing the topic of vicarious trauma to remind everyone to take a moment. We don't plan on discussing any traumatic content today, nor do we plan on discussing anything that actually distresses anyone. But when we work in these environments and you are faced with traumatic content, and maybe some of the themes we talk about today might resonate with you, it is important to take a moment if you are feeling affected by this content. So please, when we finish up, take a moment to chat to a trusted colleague, a friend, contact EAP, or even just take some time to reflect. Whatever it is that works best for you, please do that. So now I'll jump in. So what is vicarious trauma? The most simple kind of definition that we've come up with that seems to resonate with the most people is that vicarious trauma is a predictable response to work that involves repeated exposure to traumatic content. And it has 4 key features, really. The first is engaging with other people's trauma. So this is what we're talking about when we say traumatic content. So this can come in a lot of forms. It might be written, so you might get an email that includes some information about someone's trauma experience, or perhaps in a case file or case notes, you might open it up and it might be details of someone's trauma history. It could also be on the phone, and we hear about a lot of reception staff that when people are trying to engage with a critical service, they call and they disclose information about whatever they've experienced right there on the phone, and that can be quite impacting on the reception staff. It could also be visual, so pictures of a distressing event. There's all sorts of forms, and it really depends and varies on what kind of work you're doing as to how you're exposed. The second feature of vicarious trauma is that it builds up over time. So there's a slow, subtle burn to it that really involves repeated exposure. And you might think that this backpack is a bit of a funny icon to demonstrate builds up over time, but there's actually a really great analogy to go with it. So if you imagine you're putting this backpack on, and every time you're exposed to traumatic content, or you hear a distressing story, or you're just a little bit impacted by something you've heard or seen, you pop a rock in your bag. One rock, not too bad. But if you're hearing these stories or exposed to this content repeatedly every day over a long period of time, there's going to be a lot of rocks going into that bag, and that bag's going to get heavy, really, really heavy. And you won't be surprised to hear that some people find it hard to carry this burden around, and eventually something's got to give. So that's essentially how vicarious trauma works. It builds up slowly over time. The third feature of vicarious trauma is that empathy is a precondition. So to engage in trauma material and to be exposed in trauma material, it's not going to affect you if you're not engaging with it empathetically. The problem here is that a lot of these caring professions require empathetic engagement for you to be able to do your job, for you to be good at your job and to be effective and to engage with clients or offenders, to develop rapport. You need to have empathy. So essentially, to do your job well puts you at risk of vicarious trauma. The fourth feature is negative changes to worldviews. And so this can be a bit of a hard concept for people to understand. But my best example was interviewing someone who worked in the justice system a few years ago, and they were talking about how they'd worked with violent offenders over a long period of time. And as we spoke more with this person about their experience in the workplace and about vicarious trauma, they began to realise that they had had this shift happen to them, this change in their worldview. And when they were out in the street, they started looking at people and thinking, oh, what are you capable of? And with their children, they'd become quite anxious about what they might be exposed to and what people could do to them. So they became anxious about birthday parties or sleepovers or even social events. And they even started to avoid some situations. And it wasn't until we started discussing vicarious trauma with this person that they even noticed that the shift had happened. And that again reflects that slow build-up of vicarious trauma over time. It's just slowly chipping away at you and things slowly shift within you. So now that we've looked at what vicarious trauma is, it's important to know what some of the symptoms are. So as I said, there's negative changes to worldview, and more broadly, these could be defined as cynical, or you could become fearful. They're just 2 examples, but that's just more broadly rather than that description I gave you before. There's also this other group of symptoms that overlaps with PTSD symptoms. And so one of those symptoms, for example, is hypervigilance. And this is essentially the body's way of protecting you. And we perceive extreme threat, but unnecessarily. And that goes back to that example I gave you of the justice worker who began to perceive kind of threats just in their everyday environment, and they became quite anxious and worried, and were always looking out for what could happen. And that's a really clear example of hypervigilance. Another PTSD symptoms that this person was experiencing, which is also a vicarious trauma symptom, was avoidance. So they started avoiding certain scenarios that would trigger them or that they felt were dangerous. There's a whole raft of PTSD symptoms that overlap with vicarious trauma. So disordered sleep is another one. Often when we speak to people who are experiencing vicarious trauma, they talk about having trouble sleeping, having nightmares, insomnia, waking a lot. There's also, mood disturbances. People might be feeling irritable, which then affects their relationships. They might have difficulty with friendships or close relationships or family, trouble concentrating. There really is a whole list of symptoms related to PTSD and vicarious trauma, and a really huge overlap. There's also this basket of other symptoms that I like to talk about. And so under this, I've got burnout. And so burnout is kind of when you have those feelings of exhaustion and almost mental distance stemming from prolonged stress. So you really, like, the thought of it just exhausts you and you just really want to distance yourself from it. And then there's another one here that I've got compassion fatigue. And this kind of taps into that feeling where you're detached or indifferent to people's suffering or distress. And so my kind of very simple example of compassion fatigue is in parenting. There's some days where, and in the lockdowns, I remember thinking some days where at the end of the day, when I'd heard my children whinging for the whole day, by the end of the day, I really, really felt indifferent to them. And this is obviously a very, very mild case. And obviously I love my children and I mustered up the energy. So in reality, in the workplace, this can look very different and can be much more severe. But I use that example also because I want to show that these other basket of symptoms can overlap, can be caused by exposure to traumatic content, but they can also be caused in other settings where you're not exposed to traumatic content. So I got burnout at home and that wasn't traumatic. You can get burnout in a lot of health professions, even though you're not exposed to traumatic material. So they are vicarious trauma symptoms, but they could also be caused by something else. There's also this other layer of symptoms that I like to talk about, and these are kind of more workplace and community level symptoms. And these relate to so things like high staff turnover and presenteeism, absenteeism. So when people are coming to work or not working well or not coming to work at all, you might also have increased conflict in the workplace. And you can kind of see that vicarious trauma has these different levels, and then that affects the quality of the service, which then goes on to affect the community. So vicarious trauma is much more than an individual problem. Now, I've talked about the overlap between vicarious trauma and PTSD. So essentially, if they're so similar, why distinguish between the two? And in fact, a lot of diagnostic criteria actually don't distinguish between the two. They're put under the same diagnosis. But I would argue it's practical, if not critical, to distinguish between the two because of the context in which they occur. So in this diagram on the left, I've got PTSD, and it stems from exposure to traumatic events in severe cases anyway. And on the right in the blue, we've got exposure to traumatic content, and this can result in a vicarious trauma response or symptoms. Oh, sorry. So when we're talking about exposure to traumatic events, these can often be associated with a low level of control or agency. They tend to be unpredictable. They tend to be in physically dangerous situations. So you might feel threats to yourself or fear for your life when you're exposed to a traumatic event. And the impact can really come from a single exposure. Exposure to traumatic content, on the other hand, is inherent in a task or a role that we're doing. You'll know that you're doing it, so it's predictable. You might go to work knowing that today you're going to see X, Y, and Z in terms of traumatic content. You're going to hear these stories and you know what's coming up. It also tends to occur in physically safe environments, not always, but it usually happens in those kinds of environments. So I might today get an email with content that is traumatic or distressing, and I'm in my office and I'm at my desk and I'm perfectly safe. Or when we're in lockdowns, it might be, at home in our bedroom if we're working from home. It can happen, or in the office at work, it can happen in all sorts of physically safe environments. And it stems from repeated exposure, so that cumulative impact. So why this is really important is to understand this difference is because due to these contextual factors, vicarious trauma tends to be overlooked, with workplaces instead focusing on the effort on these critical incidences and how to address and mitigate the impact of them. This is despite them having such overlap in symptoms. It is also due to these contextual factors and the predictability of exposure to traumatic content, coupled with the predictability of vicarious trauma as a consequence of this exposure, that there's a real opportunity to prevent vicarious trauma. But before I jump into prevention and pass you on to Grace, I just want to quickly touch on the history of vicarious trauma and then some dominant kind of misperceptions. So vicarious trauma was coined in the early 1990s by McCann and Perlman, and they essentially observed symptoms similar to PTSD in trauma counsellors or psychotherapists, and they began to see that trauma work had an impact on people similar to PTSD. After this time, there was a huge explosion in vicarious trauma research. It's very hard to keep up. Vicarious trauma has also been documented in an array of professions. So in 2018, ISCRR conducted an evidence review and found up to 50% of workers in certain professions were at risk of mental injury due to exposure to traumatic content. As I said earlier, repeated exposure to traumatic content has also been included in the PTSD diagnosis of, I think, the DSM-5 and perhaps the version earlier as well. There's also been in this time an increased awareness of psychosocial hazards in the workplace and the role they have in contributing to people's well-being or ill mental health. So now there's kind of this big question of how do we prevent vicarious trauma and what is best practice? What can we actually do about it? And this leads me to some of the dominant misperceptions and preventions. So on the left here, I've got a list, and the first is clinical. And this basically results in this clinical perception of vicarious trauma that focuses on symptoms and diagnosis. And it's not surprising that prevention then focuses on psychological treatment and expertise. So in the workplace, this might look like someone disclosing being distressed by content to their manager, and their manager saying, I don't have the expertise to deal with this. This is a clinical matter. You need to seek EAP, the Employee Assistance Program. On the individual perception of vicarious trauma, this is probably consistent with how we perceive mental health more broadly in the community as an individual problem. And in this case, a lot of workplaces will go, oh, well, it's an individual problem. It's a personal problem. Therefore, the burden is on them to prevent it. And their focus there is on self-care strategies. So they might say, take a break, do some meditation, go for a walk, chat to a colleague, you take care of it yourself. There's another thing that we've kind of discovered as we've done our research, and this is about a resilience discourse, and that being impacted by trauma content is perceived as a lack of resilience. And the result of this is obviously resilience training, and it's seen as kind of like the cure for all the prevention of vicarious trauma. It's all right, we've thrown resilience training at our staff, it's all fine. And the third dominant and common misperception of vicarious trauma taps into how it's inherent in the role, which is completely true, but it leads to people thinking that trauma content cannot be avoided and therefore it can't be prevented and we need to get on with it. Now, I'm not saying that all of these things are completely wrong. Like I think treatment for when there is a psychological issue is completely necessary and fantastic. I think self-care strategies are wonderful. I do meditation every day. By all means, everyone meditate. And resilience training, sure, let's all be resilient and let's all work on our resilience. But what I'm saying is alone, they don't really work to prevent vicarious trauma. In fact, I'd argue they don't actually prevent it at all. They're all reactive strategies and don't really look at how they can actually change the system. Which leads me to the case for proactive prevention. I would like to suggest that instead of focusing on this clinical treatment of vicarious trauma, we flip the narrative and start talking about vicarious trauma as a normal and predictable human reaction. We don't talk about what's wrong with you and how can we fix you. We talk about what happened to you and how can we change what's happening to you. That we move from the individual burden of vicarious trauma to an organisational approach where traumatic content is seen as a workplace hazard and addressed accordingly. That we move from this resilience discourse and then shift the discussion from if you are affected to when you're affected. So it's just one word is changed, but it makes a very big difference to the culture in the workplace. And lastly, instead of brushing vicarious trauma or traumatic content under the carpet and saying it's inherent in the work we do, there's nothing we can do about it, let's modify the systems, modify the practice, and modify the policy to actually mitigate the impact of vicarious trauma. Thank you. I'll pass you on to Grace now, who will talk about proactive prevention.
Thanks, Carmen. Proactive prevention is a type of workplace intervention. And essentially, there are three different ways that we categorize workplace interventions, which are things like programs or policies that we put in place at work to try to either react to or prevent workplace injuries, which can be, in this context, we're talking about psychological injuries. So we've found, and the research shows as well, that the most common type is reactive interventions. And this isn't actually a method of prevention. So instead, it's about reacting to something or offering support to a worker after an incident or an injury has already occurred. And if you think back to what Carmen was talking about with those different perceptions, this would fit in with that sort of clinical perspective where the only way to deal with it is to sort of see a psychologist or get expert treatment, which, as Carmen said, is very valid and is necessary. So outside of a psychologist in the workplace, a common example is a workplace offering something like an employee assistance program. You might have heard EAP. I think Carmen mentioned it before. And if you haven't heard of that before, it tends to be a free service that workers can call to discuss personal or work-related issues with a counsellor. So, for instance, someone might call EAP because they're feeling really stressed out by work in general, or they might call because they're feeling rattled by something in particular that happened. So in the context of vicarious trauma, it might be that they call to discuss the content of the work. The issue that we've found with EAP, though, and the issue that the sort of research hints at with reactive interventions where you have to talk to a counsellor outside of your work, is that people can spend a really long time just explaining what they do at work in the first place, and that can really eat up at the amount of time and almost can be re-traumatizing if they have to explain to someone what it is that they're calling about. So the second type of workplace intervention is preventative, but it's called ameliorative prevention or secondary prevention. And this taps into what Carmen was talking about that individual or resilience perspective. So this is less common than reactive interventions, but historically it's the most common type of prevention for psychological injuries, which, as Carmen said earlier, probably taps into kind of, I guess, just cultural perceptions of mental health in general. So ameliorative prevention aims to prevent psychological injuries by making workers stronger, hence the little icon there, or just better able to cope with workplace stresses. So an example here, quite a common one, is resilience training, or like Carmen said, mindfulness or meditation programs. And in ISCRR's evidence review, the one that Carmen mentioned earlier, that was published in 2018, and then a second one following that up, it was found that ameliorative interventions for vicarious trauma had sort of mixed evidence, in that some can work quite well, but there's limited evidence supporting others. And finally, well, what is proactive prevention? We say proactive both in the sense of you need to be proactive about it and do it before before workers start to get injured. But it basically refers to prevention that tries to prevent work-related injuries by targeting the aspects of work that contribute to the risk of injury in the first place. So not the workers. It's about the cause of psychological injuries, and in this case, vicarious trauma, being the work. And in ISCRR's evidence review, it was found that these overall tended to have the strongest evidence on their impact on vicarious trauma. Now, before I keep going, it's really important to note that proactive prevention aligns with, I have Victorian occupational health and safety legislation and frameworks here, but there might be some viewers here from other Australian states, and this should apply there as well. And I noticed in the comments that someone is streaming this from the United States, and I know less about their legislation, but in general, don't take this as legal advice, this might apply as well. So because vicarious trauma and psychological health is a risk to workers' health and safety, it does apply under this framework. And under Victoria's OHS Act, the employer must provide what we call the highest level of protection to workers' health and safety. And in all circumstances, the highest level of protection, like the best way to protect your workers, is to eliminate the risk to their safety. So in this instance, with vicarious trauma, it could be just eliminating that exposure to traumatic content. But as Carmen touched on earlier, for a lot of people who work jobs that make them at risk to vicarious trauma, that exposure to traumatic content is kind of inherent in their jobs. So if you are a defense lawyer or a social worker, or you work in a government department working with vulnerable people in communities, for instance, you can't take away that. It's a core element of your role. But as Carmen noted, there is this misperception that if you can't take it away, then you just get on with it. And that's not the case at all. Because occupational health and safety, and I want to argue common sense, sort of say that if you can't eliminate the risk, the next highest level of protection is to reduce that risk as much as possible by targeting the causal factors. And what I'm going to go into next is just showing that that is possible with vicarious trauma. So what that means is targeting those factors that lead or contribute to the risk of injury. So not only does proactive prevention of vicarious trauma have good support in the research literature, but it's also required under occupational health and safety law, at least in the Australian and particularly in the Victorian context. And just for those people who are streaming from Victoria, there will be new OHS regulations released in the next couple of months that'll go into more depth about how to prevent work-related psychological injuries. I have lost track of my slides. So what does proactive prevention of vicarious trauma look like? How do we apply this to the work? So in order to know how to alter the work or what factors to change, we need to know what parts of the work contribute to the risk of vicarious trauma in the first place. And Carmen has already touched on the core element without which you're not at risk of vicarious trauma. And that is that exposure to traumatic content, whether it be via verbal disclosures, so people talking to you and talking about things that are happening to them or have happened to them. It can also be in files, documents, photographs, any number of things. But that exposure to traumatic content, while it's the core sort of hazard that can lead to the risk of vicarious trauma, it's not the only thing that matters. And it's also not the only thing that makes up your whole experience of work. So, what we do call everything that you experience at work, whether it's good, bad, or neutral, we refer to those as work-related factors. And this covers a whole range of things, like anything you can think of about your work experience. So workplace relationships, the level of support you receive, not just from your boss or from management, but also from your co-workers, and things like cognitive, emotional, or physical job demands. There's a whole range of them. But obviously not everything at work contributes to the risk of vicarious trauma. For instance, some can actually mitigate or lessen the risk. But some factors in the workplace become psychosocial hazards, and those contribute to the risk of vicarious trauma. And we know that they contribute to the risk not only from sort of general principles behind psychological health at work, in that these different sort of hazards act in combination with each other, but also from mapping what the research literature says contributes to the risk of vicarious trauma onto psychosocial hazards. And there's a really big overlap there, which I'll go into. So, pardon me, if you look at the diagram on the screen, you can kind of visualize it like this, in that there's many, many factors that are at play in a workplace. And of those factors, some are psychosocial hazards that contribute to the risk of vicarious trauma. And of those psychosocial hazards, one of them is exposure to traumatic content. But without that exposure to traumatic content, you're not at risk of vicarious trauma. So another way to visualize it is like this. in that exposure to traumatic content at work, alongside other psychosocial hazards that may be at play in your work environment, they both in turn contribute to the risk of vicarious trauma. What that means is that in proactively preventing vicarious trauma, employers must control both of these contributing factors. So eliminating or reducing exposure to traumatic content and eliminating or reducing all other psychosocial hazards at play. And that sounds like a big task or an intimidating task, and in some ways it is. I don't want to downplay that. But under occupational health and safety legislation, employers already have to control those psychosocial hazards. So this message is primarily about showing that you can control and reduce the risk of vicarious trauma, not as what Carmen said before, that sort of inherent, if exposure to traumatic content is inherent to the role, then there's nothing you can do. That's not the case. You can absolutely control the risk. And it's also about showing that it is about targeting your prevention at those work factors, not at the workers, not at saying that they need to simply be more resilient. So to round out the presentation, before we move on to the question round, I'll just touch on some examples of how to control both of these elements. And first, I'll start with traumatic content and then give an example from the research literature of some other factors. So when it comes to controlling exposure to traumatic content, and again, that's those written details of trauma, for instance, or visual or verbal, there are plenty of methods that might work for different offices. And if you can't eliminate a worker's exposure to traumatic content, there are different ways that an employer can reduce that exposure, and it's about that reducing. And it's also important to note that different options might work for different people within the same office, but different roles, for instance, or different positions. So one method is workload management. And the clearest example here is hiring more staff. I know that is very resource intensive, but if you can do that, if employers can do that, then it could spread existing caseloads or workloads across more people, therefore lowering that exposure just in terms of pure numbers. Again, difficult to resource. But another example could be having a greater number of positions that already exist in an organisation with a mix of duties or a mix of types of caseloads, for instance, if they're case managers, so that everyone has more of a mix at a lower level instead of some people at a very low level and some people at a very, very high, intense level of exposure. Another method to reduce that exposure to traumatic content could be offering secondments or some other form of breaks from roles that involve that frequent exposure. So in positions with really frequent, intense exposure to traumatic content, employers could look at setting a rotation system of sorts, but it kind of has to be built into the role. Another method that is quite easily achieved actually is adding some form of written barrier or flags to that written traumatic content. So this could be as simple as sort of adding a cover sheet onto documents instead of just having the details on the first page that you pick up, or adding warnings to emails, or even we've sort of heard about color coding physical files according to their content. So the sort of benefits of this are twofold, in that it might reduce exposure for instance, administrative staff, where the exposure doesn't have to be inherent to their role, but they might just get an incidental look at it as they're filing documents, for instance, or if I wander into someone's office and look down and something's on their desk and then I've just seen it. If you just add a cover sheet, that actually it's so simple, but it can reduce that exposure to people who don't have to see it. But it also offers staff who do have to see it, where it is an inherent part of their role dealing with that content, to know what they're about to pick up. So for instance, you might be able to see just a red folder or something and go, I know what that color means, and it's 4:30 p.m. and I'd prefer, it would be better for me to deal with this first thing tomorrow morning instead of just before I go home. So another method is actually making changes to the office design or layout itself, which in some senses kind of sounds like, how could that prevent a psychological injury? But for example, in an open plan office, I'm sure that those of you who've worked in open plan offices know what I'm about to say, but staff might actually overhear conversations that the co-workers are having. And in some of these roles, those conversations might contain quite a lot of quite traumatic detail. Or you might look over and see, for instance, if we're talking about photographs, some quite traumatic photographs on a co-worker's computer screen. So if you can rearrange the office just to add better barriers for sound and visual purposes, you can also reduce that incidental exposure for staff. So as you can see, there are lots of different ways that you can control and reduce exposure to traumatic content. So what Carmen was talking about earlier, that misperception that it's inherent to the role, there's nothing we can do. These are just some examples. So that's basically a false perception is what we're trying to argue here. But what about the other contributing hazards? So the Psychological Health Compliance Code, this is just for Victoria again, that will be released later this year, will give some more examples of ways to control a range of physical hazards, psychosocial hazards, my apologies. But we can also draw on the research literature on vicarious trauma. So based on the research, one method is just allowing workers flexibility, both in their work scheduling and their work tasks. So by that, I mean, just to refer back to Carmen's example about kids earlier, flexibility in scheduling could just be, I need to start earlier because I need to leave early to go pick up the kids from school. But also allowing workers flexibility in their tasks as well, both in terms of maybe what they do and when, can also make workers feel a bit more in control of what they do at work. And that can really contribute to decreasing work stress and feeling, less stressed out and less out of control. So we also know that a supportive culture helps reduce the risk of vicarious trauma. And that can take the form of formally arranged activities like peer support groups. And it can also look like having the opportunity to go to your co-workers or your supervisor and ask for their help or their perspective on a situation, for example, outside of, once a week or fortnightly or monthly supervision sessions. But what the research says is that even just having the opportunity to socially interact throughout the day in those little moments, or also on special events like a co-worker's birthday, can help workers feel more supported at work and more part of a cohesive unit and less alone. So research also shows that effective supervision helps minimize the risk of vicarious trauma. And by effective, I mean supervision that creates an environment where workers feel safe and able to express concerns about work and are able to sort of process the traumatic content that they're exposed to at work, as well as any impacts that they may be having on them. And this is sort of in contrast to what Carmen was talking about with that clinical perspective, where workers might go to their supervisor and say, I'm feeling really impacted by the things that we're doing. And their supervisor sort of goes, I can't respond to this. I can refer you to an employee assistance program or suggest that you go see a psychologist. So it's really important that effective supervision has supervisors that are able to respond to that in the moment or along the way to sort of prevent workers from getting to that level where they are very, very severely impacted. And this can be sort of in the space of one-on-one supervision. But if that's the case, it's really important that this sort of supervision where you're able to process the impacts of the work is separate from evaluation or like evaluative based supervision, where workers might discuss things like key performance indicators. And that's because if they're in the same sort of session, the workers might be hesitant to disclose how they're feeling impacted by the work if they think that it will negatively affect a performance evaluation. But effective supervision can also be in a group setting. So it can be something like reflective practice, where workers might each bring in a work scenario to discuss with the group. And that can be with an internal or external facilitator. So where to from here? I feel like we've just given you a crash course in vicarious trauma and also the prevention of vicarious trauma, and it's just sort of dipping your toes in. But if you're interested in learning more about vicarious trauma and how to prevent it, there are a couple options, multiple options. So as we've mentioned throughout, ISCRR in 2018 did a series of evidence reviews on cumulative trauma and vicarious trauma, and you can find these online on ISCRR's clearinghouse. And also, as I've mentioned before, in the next few months, the Victorian Psychological Health Regulations will be released. And while they won't specifically address vicarious trauma, they'll provide a framework for its prevention. So if you're in the Victorian space in particular, I would really recommend looking at that. And finally, the Vicarious Trauma Prevention and Awareness Toolkit will go live in approximately September, and you'll be able to find it at vtpat.org.au. And the toolkit will provide information and resources on vicarious trauma and how to prevent it. So just to summarize the key points that we've covered today, the first is that vicarious trauma is a predictable response to engaging with traumatic content. As Carmen said, in some professions, half of all people who work that job will experience vicarious trauma. It's not something out of the blue. It is a known sort of psychological threat to workers' health and safety, and therefore it needs to be prevented. And employers need to use proactive prevention. And by proactive prevention, we mean targeting the aspects of the work that contribute to the risk of vicarious trauma, not the workers. And finally, the risk of vicarious trauma can be minimized by controlling two aspects, essentially. So the exposure to traumatic content and those other contributing psychosocial hazards.
Thank you, Grace, and thank you, Carmen, for that great introduction into vicarious trauma. I'm Jimmy Twin, the Research Communications and Translation Manager at ISCRR, and I'll be facilitating this short Q&A session. Any questions that we do not get to during this session, because we understand people need to hop off to the next meeting today, we will be responding to those when we circulate the webinar link. Any other resources or materials as well will be circulating. So if you wish to obtain these, make sure that you're on our mailing list, and you can do so when you leave the webinar today. In your browser, an evaluation survey will appear, and you can enter your details there. So on to the first question, and this question I'll be directed towards Carmen, that you mentioned in your presentation that vicarious trauma is expected to occur for certain jobs, but is there any information on when it's likely to occur?
Thanks, Jimmy. It's a great question, which comes with the simple answer is no, there's not really. But there is a little bit of research to suggest they call it a bath graph. So early career, you're at high risk because you haven't really developed skills or coping strategies, or perhaps you haven't been given the right supports and you're still working out how it all works. There's a lot of factors at play. So you're high risk, but then over time that drops down. And then as you work in this field, you're relatively okay for a while, but it's as this trauma material builds up, it slowly builds up again, and then your risk increases towards the end again. So you do hear some sad stories about people retiring quite burnt out and quite impacted by vicarious trauma. But really, it varies from person to person, and it depends really on the work you're doing. So you can be impacted at any time throughout your career.
Great, thanks for that, Carmen. Next question that's come through, it's first thanking you both for a great presentation, and I agree it's such important work that you're doing at the moment. Are you able to share any examples of how prevention work can be used in the school system in primary and secondary schools, mostly how to prevent secondary traumatization of teachers who work with students who are experiencing trauma or who are trauma survivors?
That's a really fantastic question, and especially relevant to what we're doing at ISCRR at the moment. So we have a research project looking at vicarious trauma in teachers, and they're actually out collecting data right now. The tricky answer, it's tricky to answer because there's not much research in this field, so it's a real gap that we've decided to really focus on at ISCRR, and that there are some of the learnings from other workplaces that could be extended to teachers. So I think that idea of effective supports and ensuring time away, so either shifting to other activities and breaks from exposure to that traumatic content is really important, but how effective they are for teachers would really vary, and we're really hoping to get some more information on this through some of our current research.
Our next question is for yourself, Grace. What is your advice in implementing reflective practice?
Thanks, Jimmy. So implementing reflective practice, I think there are multiple ways that you can go about it, depending on the setting. For instance, we know that, as I sort of mentioned in the presentation, some people can use, or some organizations can use external facilitators. And we would say that broadly, using an external facilitator, so for example, a counselor or a mental health social worker, someone who has experience in that sort of work, is what we would call the gold standard, honestly, just because it sort of gives people a chance to talk about their work without sort of worrying about negative repercussions that may come back on them. But we also know that it can really still work when organizations have to use internal facilitators, as long as there's that sort of trust and cohesion in the group. But we also know that a lot of people and a lot of organizations can sort of be wary of reflective practice at first. In some fields, it's really common and people don't blink an eye, but in some fields, it's sort of new and there's a bit of wariness about it. But we've found that broadly, once it is implemented, after a few sessions, people have sort of been like, hey, this is actually really good. But in terms of funding things, if funding's an issue, you could look to people within the organization that are willing to sort of be a champion of it and sort of skill up a bit or have experience with reflective practice. And we've also sort of heard anecdotes about organizations that have been able to get funding through things like their insurer. Carmen, did you have anything to add there?
Done a great job, Grace. Covered nicely.
I have a follow-on question that links nicely to this. You mentioned, Grace, talking about like one of the barriers about funding for such initiatives. But Carmen, what does the research suggest with regards to potential barriers when implementing these types of measures?
Yeah, it's really interesting. We've observed this a lot over the last few years and experienced those barriers ourselves. And so one of the main factors we found is cultural maturity within an organisation, and kind of that taps into their level of readiness to really tackle vicarious trauma. So often when we've tried to work with teams or organisations, we found that if they're not ready, we actually have to go in and undertake a pretty significant educational program. And that includes about vicarious trauma, but also about what Grace was talking in that proactive prevention space and what that means. And it's really challenging those common misperceptions, because if that cultural maturity isn't there, you just get thrown those misperceptions and say, we're already, addressing this. Whereas it's not actually an effective approach and it's not actually preventative. So really cultural maturity is probably the biggest barrier that we've come across.
Yeah, just to add on to that, Carmen, I would find that I agree wholeheartedly with everything that you just said. And also I think sometimes organizations and workplaces are really ready to prevent vicarious trauma, but they get stuck, I think, at what proactive prevention means and how to prevent it. And I think that a lot of places seem to get stuck at that prevention means making the workers better able to cope or more resilient. And there's sort of a lot of education that needs to be done really to push people to think about upper level about the workplace factors that contribute.
Thanks for that. And for our next question, and I think that Grace, this is probably more appropriate for yourself to respond, but Carmen, if you have thoughts as well, that what would you do if you think yourself or a colleague has experienced vicarious trauma?
Pardon me, I'm just coughing. Yeah, so it's obviously it's a really common circumstance, as we said, in some fields in particular. And what we're aiming to look at is sort of minimizing the extent to which that happens. But if you are in that situation, even though we've just spent a lot of time talking about how, you know, it's not enough for organizations to say, contact your employee assistance program or go see a psychologist. Really, if you are experiencing the impacts, that is one of the things that I would recommend is talking to people about it or a medical professional. And also, there are still things that you can do at work. So if you're, for instance, again, I'm not sure about the American setting, but in Australia, if your workplace has a health and safety representative, you might be able to start talking sort of at that occupational health and safety level about things that your workplace could do to prevent it from happening to other people, or sort of just chat to people about what options there are that are available. Carmen, did you have anything to add there?
Yeah, I think just that it can be an opportunity to report it. We do find that a lot of workplaces say we don't have any data on vicarious trauma. And so if you do think you are affected, it can be helpful to report it through whatever the reporting mechanism is for a workplace injury at your workplace. And then it helps create data and evidence for why it needs to be prevented. But then again, it's whether you're comfortable to do that.
Thanks for that. We only have time for one more question. So as I said before, that we will forward responses to any unanswered questions. So if you do have any more questions, feel free to send them through and our panel of experts will respond to these. But I think for a nice wrap-up question that's come through, where can employers look for further guidance on how to prevent vicarious trauma in the workplace?
Yeah, thanks, Jeremy. So I might jump in on this one just because it relates to one of the slides that I had up, is that in terms of practical guidance, there's kind of a gap at the moment, but over the coming months, there will be a lot more things available. So for instance, in that Victorian space, there'll be the regulations and a compliance code released. I think New South Wales, if there's any viewers coming in from there, they also have a code of practice. And the Vicarious Trauma Prevention and Awareness Toolkit will be live for people to look at in approximately September, and that will have a lot of guidance and stepping people through the process as well. There is also some training that's available, not necessarily in that prevention and how to prevent at the workplace level space, but I know organizations like Blue Knot, KNOT, they do have training about vicarious trauma that you can attend in, I think, all of the Australian state capitals at least. And as we were saying, a really important first step is ensuring that people have that understanding about vicarious trauma. Yeah, Carmen, am I missing anything in that answer?
I was just going to mention that ISCRR is putting together a lot of research on this at the moment, and we are looking at training available and what the best approach is to that. So there will be more findings to come out of our project in the coming months.
Okay, thank you so much, Carmen and Grace, for a wonderful presentation. And I particularly like that analogy with the backpack and, you know, each little stone or rock, you know, is small itself, but they accumulate over time.